Hello, I'm Mark Pegram. I'm a medical oncologist at the Stanford University School of Medicine and the Stanford Cancer Institute. I'm the Associate Director for Clinical Research there and a member of the Breast Oncology Program. Well, I had the opportunity to observe so-called exceptional responders early on during the drug development of trastuzumab. The brand name of that, of course, for patients watching the video is Herceptin. And I'll just tell you a couple of examples of patients that we saw back in the early 1990s who were first being treated really for the first time in phase 1 studies with the HER2 antibody drug trastuzumab Herceptin. So we had a patient at UCLA who was in the first clinical trial, the phase 1 study of chemotherapy plus Herceptin. We had shown in the laboratory that Herceptin and chemo can be synergistic, and we felt that that would be a path forward to integration of Herceptin into the therapeutic armamentarium to treat HER2 positive breast cancer. And we had this patient with multiple pulmonary lung metastasis, as well as spread to the lymph nodes above the collarbone, a so-called supraclavicular lymph node. And we biopsied these metastases, and they were proven to be HER2 positive metastatic breast cancer, stage 4. This patient was treated on a phase 1 study, which only gave 4 cycles of one chemo drug, along with only 16 weeks of Herceptin. And the reason it was such a short exposure is because that was really all the Herceptin that was available in terms of manufacturing in order to do this trial. That patient had a clinical complete response and never relapsed since for the rest of her life. So unbelievable, dramatic example of a HER2 positive breast cancer patient with a so-called exceptional response to minimal amounts and duration of treatment, just one chemo agent and one HER2 antibody, Herceptin. And that was enough to put her into a complete remission, and she never had a recurrence. Another patient I had was in a later line study in either phase 2 or 3. And this patient was a nurse who lives in Bakersfield, California. And she came to us at UCLA, also seeking participation in a clinical trial of a combination of chemo plus trastuzumab Herceptin. Her clinical presentation was stage 4 breast cancer. Her liver was completely packed with breast cancer, biopsy proven, HER2 positive. Her liver was so involved by the metastatic breast cancer that she had liver failure. She had a backup of blood into the veins of her esophagus that became very dilated, and they were starting to bleed. So she was having these bleeding events due to high pressures in the liver called portal hypertension. She was getting swelling of her abdomen due to fluid buildup from liver failure. So dramatic clinical presentation of advanced cancer. So she was treated with chemotherapy plus Herceptin, trastuzumab. Again, had essentially a clinical complete response. There were a few fibrous scar-looking lesions that were left in the liver after the chemo plus trastuzumab study protocol treatment. But these never changed over many years. And she elected to stay on Herceptin for many years. Since she was a nurse, she ultimately had it delivered to her house, and she would hang it herself IV and access her own port after many years of treatment. I tried to convince her after 5 years to discontinue the treatment because I thought she probably was cured at that point with continuing remission for all that time. She was superstitious and absolutely insisted on continuing on treatment. So at year 10, I tried to convince her to stop, but again, she wouldn't listen. And finally, sometime around 15 years or so, I can't remember the exact number of years, but I think eventually her IV access became problematic and she eventually agreed to stop. And she never had a relapse event since. And she actually attended my professorship ceremony when I first came back to California to join the Stanford Cancer Institute. Back in 2012, she was alive and well, and no sign of cancer. And that was her treatment was in the early 1990s. So she was effectively cured of HER2 positive metastatic breast cancer with chemo plus Herceptin. remarkable case.